How many times have you heard this? Vitamins are good for your brain, good for your heart, help you sleep better, keep your memory sharp. So like many others, you take a few pills every day, mindlessly, as if it's just what you're supposed to do. But what if I told you that the very pills labeled good for your health could be the same ones that trigger a stroke while you sleep? Sounds frightening, doesn't it? I invite you to picture this seriously. It's a quiet evening. You're sitting on the sofa, reading a book to your grandchild nestled beside you. Your voice is calm. Their eyes are following every word. Everything seems peaceful until you suddenly stop. Your arm grows heavy. Your lips move, but no sound comes out. The room fades. Then everything goes dark. When you open your eyes again, all you see is the white ceiling of a hospital room, and a nurse calling your name, slowly, carefully, like she's not sure you're still there. I'm a physician specializing in brain health, and over my 20 years of practice, I've witnessed far too many moments like this. What haunts me the most isn't the stroke itself. It's the look of shock and regret on the faces of people who thought they were doing everything right. They don't drink, they don't smoke, they never skip meals, they exercise daily, they drink plenty of water, and they never forget their morning vitamins. Yet they still collapse, suddenly, silently, with no warning signs at all. Why? Because after age 60, your body no longer functions like it did at 30. Your liver detoxes more slowly, your blood vessels grow thinner, your nervous system becomes hypersensitive to the smallest shifts. And sadly, those very vitamins, the ones promoted as good for your heart, your brain, your sleep, can backfire if taken at the wrong dose, at the wrong time, or by the wrong person. Especially at night, when blood pressure fluctuates, the body enters recovery mode and becomes most vulnerable. I'm not here to scare you. I'm here to warn you, as someone who's seen far too many tragedies caused by something as innocent-looking as a vitamin. And in the next part, I'll walk you through 9 common vitamins, from D, E, B6, A, K, and even those brain-boosting ones you take every day that can quietly do harm if misused. If you or a loved one are taking any kind of vitamin, especially at night, don't skip what comes next, because sometimes it takes just one small pill used the wrong way to trade years of health for a lifetime of loss. You've probably been told this before. After age 60, you should take vitamin D every day to prevent osteoporosis. That advice isn't wrong, but it's not entirely right either, especially if you don't understand how your body processes this particular vitamin. Vitamin D helps the body absorb calcium. That part is common knowledge. But what most people don't hear is this. Too much vitamin D doesn't make your bones stronger. It thickens your blood, and it can make your blood vessels as brittle as glass. I once treated a man named Walter, a 74-year-old Navy veteran living in North Carolina. He had remarkable discipline, cooked his own meals, ate clean, walked every day. No smoking, no diabetes, no heart disease. And every morning, at exactly 7 a.m., he took a vitamin D pill, 10,000 IU, recommended by a friend. The label said, "Healthy bones." So he believed it. No doctor prescribed it. No blood tests were done. Until one morning his wife found him motionless in a chair. His right arm wasn't moving. His mouth was drooping. His eyes were blank. A stroke, and not a small one. The test results shocked his entire family. His blood calcium was sky high. His arteries had hardened. His blood pressure had spiked while he slept. It was the vitamin D, the very thing meant to strengthen his bones, that was drawing excess calcium out of his bones and depositing it into his bloodstream. That calcium built up on artery walls, making them stiff and less flexible. This is the silent trap. No pain, no symptoms, just one night when all the wrong conditions align. Hardened arteries, rising blood pressure, and thickened blood from mild dehydration. And the stroke hits in your sleep. Vitamin D is fat-soluble. That means your body stores it instead of flushing it out like vitamin C. It accumulates over time, day by day, week by week. Most over-the-counter vitamin D supplements contain 5,000 to 10,000 IU per pill. But the actual daily need for older adults is only 600 to 800 IU, unless a blood test shows a real deficiency. There's something else many people miss. Taking vitamin D at night, when your blood pressure naturally fluctuates, can make it harder to control your BP, especially for those with vascular issues. That's why, if you truly need vitamin D, make sure you take the correct dose, take it in the morning, and most importantly, only take it under a doctor's guidance. After a blood test, Walter is still alive, but he struggles to walk and can no longer drive. When I asked if he knew what caused it, he slowly shook his head and said, "I just wanted to protect my bones. I never thought I was laying a trap inside my own blood vessels." That's why I always remind my patients, vitamin D is not the enemy, but only if used at the right dose, the right time, and for the right reason. Used carelessly, it can quietly rob you of your ability to walk, speak, and live independently, the very things you've spent a lifetime protecting. If vitamin D silently stiffens your arteries, then vitamin E may do something even more frightening. It can cause blood vessels to rupture inside your brain, especially if you're also taking blood thinners or a daily aspirin. The scariest part, most older adults have no idea. That's because the label on the bottle sounds sweet and harmless, supports heart health, antioxidant, improves circulation. And naturally, you'd think, if it's good for the heart, isn't it good for the brain, too? I once treated a patient named Evelyn. She was 81, a retired librarian from Ohio, sharp, thoughtful, always well put together. Every afternoon she would sip tea and read novels by the window, a quiet habit she had kept for decades. Alongside her tea, she took a daily vitamin E capsule 800 IU. It was labeled natural and heart healthy. She wasn't careless. She truly believed it helped keep her heart strong and her mind sharp. But she never mentioned it to her doctor, and she didn't know she was taking warfarin, a powerful blood thinner, while vitamin E in high doses also acts as a natural anticoagulant. This silent combination built up over time. Until one evening, Evelyn developed a severe headache, began slurring her words, vomited, and collapsed onto the floor. An MRI at the hospital showed a brain hemorrhage, not from a fall, not from high blood pressure, but because her blood was too thin, it couldn't clot. A tiny vessel had ruptured, and the bleeding began to compress her brain from within. Most people don't realize that vitamin E, when taken in high doses, usually over 400 IU per day, can act almost like an antiplatelet drug, similar to aspirin or Plevix. If you're already on a blood thinner, or even just a low-dose aspirin, the combination can silently push your body past the safety line, especially in the brain, where blood vessels are tiny and fragile. When I asked Evelyn why she took the supplement, she cried and said, I just wanted to keep my heart strong. I never thought I was causing a bleed inside my brain. That moment stayed with me, not because of her mistake, but because of her intention. She did it to live longer, to stay healthy, like millions of older adults do every day. But sometimes, the very things we believe are good for us, if misunderstood, can turn into a double-edged sword. If you're taking blood thinners, heart medications, or a daily aspirin, look closely at your vitamin E bottle. Don't let the numbers 200, 400, or 800 IU fool you. The actual need for older adults is only about 15 milligrams, or roughly 22 IU, and that's usually already in your food. There's no need to supplement unless your doctor tells you to. Because while blood that's just thin enough can protect your heart from clots, blood that's too thin can rupture a tiny vessel in your brain and take away your ability to speak, walk, or even recognize the person you love most. Some health dangers strike like a sudden blow, fast and clear, but others creep in silently, like a fraying wire slowly losing current without anyone noticing. That's exactly how vitamin B6, often praised for nerve support, can quietly damage your nervous system without you even realizing it. Many people take vitamin B6 in hopes of easing numbness or tingling, boosting memory, improving circulation, or sleeping better. You'll see it in bottles labeled nerve support, brain boost, or memory formula, available in nearly every drugstore and health website. But what no one tells you clearly is this: vitamin B6 can become a neurotoxin when taken in high doses over a long period of time. I still remember the case of Harold, a 76-year-old, retired long-haul truck driver from Kansas. He had spent his life behind the wheel, crossing state lines with nothing but coffee, maps, and his fierce independence. After retirement, he decided to take better care of himself, clean eating, light exercise, and a supplement called Neuromax Nerve Defense. Each pill had 100 milligrams of vitamin B6. He took 2 pills a day like clockwork, as if starting up his rig. At first, he just felt mild tingling in his fingers, some trouble balancing while standing for too long. But then, it got worse. Each morning, his hands felt numb. His legs walked, but without power. "Like my brain couldn't tell my legs what to do anymore," he said. One morning, he collapsed in the bathroom. That's when his son brought him in to see me. Looking at his lab results and his supplement list, I was almost certain of the cause. Harold had been consuming 200 milligrams of vitamin B6 daily, 10 times the safe upper limit for older adults, which is about 20 milligrams per day, including from food. The saddest part, nerve damage from excess vitamin B6 isn't always reversible. Vitamin B6 isn't easily flushed from the body. It builds up, and once it does, it strips away the protective layer around your nerves, like peeling insulation off an electrical wire. Signals from your brain get weaker, distorted, and eventually stop altogether. Harold was lucky he could still walk, but he now relies on a cane and can no longer drive. One afternoon in my office, he looked down at his hands and said quietly, "I just wanted to keep my mind sharp. I didn't know I was making my legs weaker." So, if you're taking any supplement that claims to support your nervous system, flip the bottle over and check how many milligrams of vitamin B6 does it have. And if you're already feeling numbness, muscle weakness, wobbly when standing, or like you're losing control of familiar movements, don't be so quick to blame aging. It might be the very pill you trusted that's quietly disrupting the connection between your brain and body, bit by bit, day by day. When people think of vitamin A, the first thing that comes to mind is usually good for the eyes. Bottles of supplements proudly display phrases like vision support, eye defense, or immune boost. And just like that, many older adults add it to their list of daily must-haves. But few realize that this seemingly harmless vitamin could slowly increase the pressure inside your brain day by day, almost like a silent, invisible tumor growing behind your forehead. I clearly remember a patient named Dorothy, a 79-year-old retired piano teacher from Oregon. Elegant, independent, and a lover of Beethoven, she could still play the Moonlight Sonata from memory. When her vision started to blur slightly and her skin felt drier, she thought she needed a little anti-aging support. So she began taking a multivitamin with 10,000 IU of vitamin A every day for nearly 5 years. It all started subtly. Recurring headaches, dizziness, blurry vision, difficulty reading music notes. Then one day, while on a phone call with her daughter, Dorothy suddenly began to slur her words, and then fell silent. Her family feared it was a stroke. But when she arrived at the hospital, her MRI showed no bleeding or clots. Instead, we discovered she had abnormally high pressure inside her brain, a condition known as pseudotumor cerebri, or false brain tumor. Dorothy's body, over the years, had accumulated toxic levels of vitamin A. Unlike water-soluble vitamins like C or B, vitamin A is fat-soluble. It doesn't flush out easily. It gets stored in the liver and fatty tissues. And once it builds up past a certain point, it triggers excess fluid production in the brain, increasing pressure on the brain itself, the eyes, and the spinal cord. If left undetected, this pressure can permanently damage the optic nerves, leading to irreversible vision loss. When we asked Dorothy more about her supplements, she had no idea her dose was too high. 10,000 IU a day sounded perfectly normal. Many anti-aging products advertise it proudly. But in reality, the safe recommended intake for older adults is only around 2,500 to 3,000 IU per day, including what you get from food. With a diet already rich in vegetables, chicken liver, and eggs, the supplement pushed her well over the safe limit, day after day. She had to stop all supplements, undergo treatment to lower her brain pressure, and spent months recovering her balance and eyesight. But she never played piano the same way again. I still remember her voice, shaking as she said, "I just wanted to keep my eyes strong enough to see the music. I didn't know I'd lose the ability to play it." After 60, the liver doesn't work as efficiently as it once did. Taking fat-soluble vitamins like A without medical guidance or dose awareness is like planting a silent risk. You may feel fine for months, but one small shift inside your body, and the pressure can surge, bringing consequences that can't be undone. So if you or someone in your family takes a daily eye health vitamin, check how much vitamin A is inside. Don't let a tiny pill, meant to protect your vision, be the very thing that fades the most meaningful parts of your life. One thing I often hear from older patients is, "I don't want to rely on meds. I want to manage things naturally." That statement always comes with determination and good intentions, but sadly, sometimes natural isn't as gentle as we hope. Take niacin, also known as vitamin B3. It's widely promoted as heart-healthy, cholesterol-lowering, and great for blood circulation. Sounds convincing, right? But in many cases, high-dose niacin is actually the hidden trigger behind sudden, unpredictable mini-strokes especially in the early morning hours. I remember a patient named Frank, 82 years old, retired after decades working for the post office in Florida. A kind, sharp-witted man who was adamant about avoiding statins. He believed he could manage his cholesterol naturally with a clean diet, regular walks, and a heart-boosting supplement he found online, a capsule containing 1,000 milliliters of niacin. He took 2 a day, morning and evening, like clockwork. At first, things seemed fine. He experienced mild flushing red face, warm ears. He jokingly called it his niacin glow. But then, small signs began to show up. Waking up with a racing heart, dizziness upon standing, a strange floating feeling in the morning. One morning, while reading the newspaper on his porch, he suddenly started slurring his words. For a few minutes, he couldn't remember his daughter's name. He brushed it off as just aging until it happened again, this time with numbness in his right hand. His wife brought him to the hospital. That's when we discovered he'd just had a TIA, a transient ischemic attack, or mini-stroke. The cause wasn't clogged arteries. It was unstable blood pressure swings every morning, sometimes spiking sharply, other times crashing without warning. Niacin, especially in high doses, has a unique effect. It causes sudden blood vessel dilation, leading to that warm flush. But after that, the vessels constrict again, creating a yo-yo effect on circulation. Younger bodies can usually adjust, but in older adults, especially those with fragile vessels, on blood pressure meds, or slightly dehydrated after sleep, that yo-yo can trigger a brain event before breakfast. Even the no-flush or slow-release niacin products aren't risk-free. Slow-release versions have been linked to liver issues. No-flush types often don't lower cholesterol effectively, but can still interact negatively with heart or BP medications. Frank stopped the supplement immediately after his incident. He recovered well, but he walked slower, forgot things more easily, and lost his confidence about going out alone. During a follow-up visit, I still remember what he said to me. I just wanted to do the right thing. Didn't realize I picked the wrong way. If you or someone you love is taking any supplement that contains niacin, whether for heart health, circulation, or energy boost, check the label. If it says more than 50 milliliters per capsule, don't go it alone. Ask your doctor. Because after 60, managing cholesterol is important, but staying steady, balanced, and avoiding morning surprises is what truly protects the rest of your life. When people talk about dangerous vitamins, vitamin K rarely makes the list. It doesn't show up in scary headlines, and it doesn't cause dramatic symptoms right away. But that quietness is exactly what makes it risky. Especially if you or someone you love is on blood thinners like warfarin or aspirin to prevent stroke. I once treated a woman named Eleanor, 84 years old, a retired music teacher, living a calm and structured life in Vermont. She had a morning walk around the neighborhood, Sudoku after breakfast, and a cup of tea at 2 p.m. like clockwork. She had atrial fibrillation, a common heart rhythm issue in seniors, and was on warfarin to prevent blood clots from forming in her brain. Everything was stable. Her INR, a number that tells us how long it takes her blood to clot, was always within the safe range. Until one day, it dropped suddenly. And right then, she had a mini-stroke, slurred speech, memory gaps, and a pounding headache. We checked everything. Her heart was steady, her blood pressure fine. Nothing explained the drop. until she showed us a new multivitamin she'd just started taking because it was made for people over 80. Right there on the label, in tiny print, 120 micrograms of vitamin K, more than enough to cancel out the effect of warfarin. At the same time, Eleanor had started eating more leafy greens following a heart-healthy eating article in a senior magazine. What she thought was a great combination for her health was quietly thickening her blood. So much so that warfarin couldn't keep up and a tiny clot slipped through. Now, vitamin K does have an important job. It helps your blood clot when you're injured. But if you're on a blood thinner to prevent strokes, any sudden increase in vitamin K from supplements or greens can tip the balance in the wrong direction. The scariest part? You don't feel anything. No dizziness, no pain, no warning, until one tiny vessel in your brain gets blocked, and suddenly you can't speak, can't remember your grandson's name, or can't move one side of your body. After her emergency, we adjusted Eleanor's warfarin dose, removed the multivitamin, and most importantly, we told her to keep things stable. No big diet changes, no new pills without checking, even if it says natural, gentle, or specially made for seniors. I still remember the look in her eyes when she said, "I just wanted to eat better. I didn't know it would make my blood turn to glue." And she's not alone. Many older adults are trying their best to live healthier, but they're never told how small choices can affect the medications they rely on daily. So if you're on any blood thinner, warfarin, Coumadin, or even just daily aspirin, check everything you're taking. And if you're eating more greens or switching multivitamins, let your doctor know. Because in medicine, stability, not more is better, is what truly protects you from the kind of stroke no one ever sees coming. There's a quiet fear that many older adults carry with them every day. The fear of forgetting your grandchild's name, calling your son the wrong name, looking at someone you love, and drawing a blank. And because of that fear, many people turn to memory supplements, those bottles labeled brain support, mental clarity, or cognitive boost. It feels like a quiet defense against aging. But buried inside many of these formulas is one common ingredient, folic acid, praised for brain health. But when taken the wrong way, especially in high doses, it can silently cover up a far more dangerous deficiency. Vitamin B12. I once saw a patient named Carol, 70 years old, a retired court clerk known for her razor-sharp memory. She loved word puzzles, carried a novel wherever she went, and could recall names from old court cases, like a walking archive. But slowly, things changed. Her family noticed her repeating stories. She missed a dental appointment. She couldn't find her keys even when they were right in her coat pocket. Her husband started to worry. Was this Alzheimer's? Like many, she took the proactive route, starting a memory supplement. Right on the label, 800 mcg of folic acid, a high dose of vitamin B9, often advertised as brain-friendly. She told herself, even if it doesn't help, at least I'm trying. But in truth, she was making things worse. At high doses, folic acid can mask the symptoms of B12 deficiency, especially in older adults who naturally absorb B12 less efficiently. By the time Carol came to see me, her confidence was fading. She struggled to find words, felt unsteady when walking, said her mind felt like it was wrapped in fog. Her blood tests showed very low B12, the real culprit behind her symptoms. but her folic acid was high, and other blood markers looked normal. It was like putting fresh paint on a collapsing house. It looked okay from the outside, but inside, the damage had already begun. Without specific tests like methylmalonic acid, MMA, or homocysteine B12 deficiency, can hide in plain sight. Until the brain and nerves suffer irreversible harm. After stopping folic acid and starting high-dose B12 therapy, Carol began to improve. But it took months before she felt confident, speaking and walking on her own again. One day, in my office, she gently held my hand and whispered, "I thought I was helping my brain. I didn't realize I was silencing it, piece by piece." The truth is, after age 60, B12 absorption declines, especially for those on medications like metformin, for diabetes, or acid blockers, for heartburn. And if, during that time, you're also taking in large amounts of folic acid, whether from supplements, fortified breakfast cereals, or multivitamins, you might be hiding a serious deficiency without realizing it. So, if you or someone you care about is taking brain supplements, check the label. If it contains folic acid, make sure B12 levels are not just normal on paper, but truly active in the body. Because sometimes what looks like early dementia is really your nervous system quietly begging for a nutrient it's missing. And that kind of memory loss can be reversed, but only if caught in time. Every time the weather changes, you've probably heard someone say, "Take more vitamin C, it'll boost your immune system." So you tear open a fizzy powder pack, stir it into a glass of water, and down it with satisfaction. After all, it's just vitamin C, right? Totally safe, water-soluble. Whatever your body doesn't need just gets flushed out. Right? Not quite. Especially not after age 60, when your kidneys start to slow down, your blood pressure fluctuates more, and your body no longer shrugs off those high daily doses the way it used to. Vitamin C, when taken incorrectly, too much, too often, for too long, can quietly burden your kidneys, blood vessels, and even your heart. I remember a patient named Alan, 79 years old, a retired firefighter living in Montana. Strong, stoic, and the kind of man who avoided doctors unless absolutely necessary. He came in for persistent lower back pain, frequent nighttime urination, and unusual fatigue. When I asked about his routine, he was confident. He ate clean, slept early, and took 2 1,000 milligrams fizzy vitamin C packets every single day. Just to be safe, he said. He believed his aging immune system needed daily reinforcements, but the blood work and kidney ultrasound told a different story. Alan's kidney function was declining. His lab results showed signs of oxalate build-up tiny crystals that form when excess vitamin C is broken down. His blood pressure was also swinging erratically in the mornings. Here's what many people don't realize. When you consume too much vitamin C, the surplus doesn't just pass harmlessly through your urine. It gets converted into oxalate, a compound that can crystallize and lead to kidney stones, or worse, inflammation of kidney tissue over time. Young, healthy bodies may handle this just fine. But for older adults, especially those with weakened kidneys, high blood pressure, diabetes, or low water intake, the risk becomes much more serious. And there's more. High doses of vitamin C can increase iron absorption, something that sounds good, until it leads to iron overload in the liver, heart, and brain. In older men and postmenopausal women, that excess iron can silently trigger vein inflammation, heart rhythm issues, and even nerve damage. And all of that can begin with a daily fizzy tablet you thought was doing something good. I advised Alan to stop the habit immediately. We shifted to a kidney-friendly diet, and after a few months of follow-up, his numbers began to stabilize. But I'll never forget the quiet way he thanked me. I thought I was protecting my body. I didn't realize I was pushing it past its limit every single day. If you're taking high-dose vitamin C in tablets, fizzy powders, or chewables, pause and reconsider. After age 60, your body simply doesn't need that much. The recommended daily amount? Just 75 to 90 milligrams, which you can easily get from a single orange, a handful of strawberries, or a serving of leafy greens. Because good health doesn't come from extreme actions. It comes from consistency, balance, and understanding how your body is changing with age. A good night's sleep is one of the quietest dreams for people over 60. When sleep becomes fragile, when waking up at 3 a.m. feels routine, and when even the smallest stress adds to a long, draining day, many seniors turn to magnesium. Often called a natural relaxant, magnesium is found in bedtime teas, evening powders, or capsules taken just before bed. And it's true, magnesium can help with sleep, reduce muscle cramps, and calm the nervous system. But only when used correctly. I once treated a patient named Richard, 85 years old, a retired mechanic who lived alone in Indiana. He was independent, strong, only had mild hypertension, still did his own grocery shopping, washed his own car, and even fixed old watches for neighbors. One winter morning, a neighbor noticed he hadn't picked up the newspaper. They knocked. No answer. Eventually, they broke in and found Richard unconscious on the bathroom floor, next to the sink. His forehead was bruised and swollen, his eyes still slightly open. At the hospital, his heart looked fine. No brain bleeding, but his blood pressure was dangerously low, just 85/50. Surprisingly, it wasn't his blood pressure meds that caused it. It was the bedtime powder he drank each night, each scoop containing 400 milliliters of magnesium citrate, and Richard had been taking 1.5 scoops nightly, hoping for deeper sleep. That's how he unknowingly pushed his blood pressure too low, right at the most vulnerable time, while asleep. Magnesium relaxes blood vessels and soothes nerves, but in high doses, taken right before bed, especially combined with antihypertensives or diuretics, it can dilate blood vessels too much, leading to a sudden drop in blood pressure when you stand up. This can cause dizziness, loss of balance, and falls. It's especially dangerous at night, walking into the bathroom, where a cold, hard floor is just one misstep away from a head injury or a fractured hip. Richard didn't have a stroke, but he needed 6 stitches on his forehead, and has never lived alone since that day. I still remember what he said at his first follow-up. I just wanted to sleep better. I didn't think a warm drink could land me in the hospital. It sounds simple, but that one line captures the regret of so many older adults, those who trusted natural products, not realizing they can act just like strong medications. If you're taking magnesium, double-check the dosage. For older adults, the recommended daily intake is about 320 milligrams for women and 420 milligrams for men, including what you get from food, like leafy greens, nuts, beans, and fish. And if you're already on blood pressure meds, vasodilators, or have ever felt lightheaded when standing up, please speak with your doctor first. Magnesium isn't bad, but timing, dosage, and what you combine it with make all the difference. Because after a long, tiring day, you deserve a peaceful night's sleep. One that's restful, but safe. Not one that ends with a fall in the dark, alone and unheard. It's not about more pills. It's about less confusion. If you've made it this far, you might be feeling a bit uneasy. Maybe you're glancing toward your kitchen cabinet, where rows of colorful bottles sit neatly in place, each one promising something. Immune boost, heart support, sharper memory, better sleep, stronger bones. And maybe, just maybe, you're like so many older adults I've met. Living healthy, eating well, truly trying to take care of yourself, but still waking up tired, still feeling lightheaded in the morning, still having days where your thoughts feel lost in a light fog. Let me tell you this not as a doctor, but as someone who's walked alongside many. The problem may not be what you're missing. It might be that you're doing too much, too many things, too many pills, and not enough clarity. I once treated a woman named Margaret, 73 years old, a retired school principal, organized, detail-oriented, calm and kind. When she came in, she brought a large zip bag filled with supplements. Pills for her eyes, for her bones, for her skin, for her memory, for her sleep, for her heart. Every one of them was labeled good, natural, supportive. And she took each one faithfully, every day. But still, she woke up sluggish, still stumbled a bit when stepping out of bed, still forgot little things, and couldn't understand why. I didn't ask her to stop everything overnight. Instead, we began a process I called a health declutter, the same way she used to clean out her classroom at the end of each school year. We removed the supplements she didn't really need. We stopped anything without a clear medical reason. And instead of starting her day with a fistful of pills, she began with a simple breakfast. Boiled eggs, a few slices of avocado, whole grain toast, a handful of blueberries, a warm glass of water. We weren't chasing miracles. We just went back to the basics and did them right, consistently. Each evening she took a light walk around the neighborhood. Each morning she stretched her legs while brushing her teeth. Each night she slept in a quiet room, no glowing phone screen by the pillow. After 6 weeks, Margaret didn't feel 20 years younger. But she said something that made me smile. I don't need to be young again. I just want to see myself clearly in the mirror and not feel lost every morning. The body after 60 doesn't demand complexity. It needs rhythm, stability, and a little patience. Vitamins aren't bad, but they should be used when truly needed based on lab results, medical guidance, and thoughtful monitoring. Used right, supplements can support your health. Used wrong, too much, too long, or without clear purpose, they can harm your brain, your kidneys, your heart, and your confidence. So if you have a cabinet full of bottles and you still don't feel better, don't rush to buy more. Start by doing less. Take a closer look, ask better questions, and be selective. Because your body doesn't need more from you. What it truly needs is for you to understand it better. It's not the pill, it's the awareness that saves a tired brain. If you've made it this far, I believe you're not just watching another health video. You're doing something much more meaningful. You're listening to your body with ears that have already heard too much good and bad advice. You're looking at your medicine cabinet, your meals, your daily habits, and quietly asking, am I truly helping my body, or just repeating habits no one ever questioned? And if you're like the millions of others who once believed, a daily vitamin C tablet guarantees immune protection. A little vitamin D at night is good for the bones. A memory booster pill keeps your brain sharp. Then allow me to say what I once told my own mother. It's not that vitamins are bad, but after 60, your body doesn't need more, it needs what's right. Less noise, more clarity. Let this sink in. Too much vitamin D can harden blood vessels in the brain. Vitamin E combined with blood thinners may cause brain bleeds. Excess vitamin B6 can throw off your balance and leave you disoriented. Overdoing vitamin C may strain your kidneys in silence, and the list goes on, not because vitamins are dangerous, but because no one warned us clearly enough. The scariest part isn't the illness itself. It's not knowing where it came from, and continuing with health supplements. Until one day your legs feel unsteady, your vision dims at night, or your memories begin to fade, the same ones you once held so vividly. If this video helped you reflect on something in your routine, drop a 1 in the comments. If you disagree or have questions, write a 0 and share your thoughts. I'll read and reply to every on. And if you're now wondering, so what does a healthy day really look like after 6 from breakfast to bedtime? That's exactly what the next video is for a simple gift from me to you. Thank you for staying with me till the end. Wishing you a peaceful evening and a restful sleep, without those unclear little pills by your bedside.